Cardiovascular disease, CVD, represents a group of disorders of the heart and blood vessels and is the #1 cause of death globally. It includes conditions such as coronary artery disease, heart failure, arrhythmias, stroke, and hypertension. The management of CVD has evolved over the years with advances in medications, surgical interventions, and lifestyle modifications, leading to improved patient outcomes. However, despite these efforts, many patients with cardiovascular conditions still face limited treatment options, particularly those with severe heart muscle damage or those who are in the advanced stages of heart failure. As a result, researchers have been looking for new, innovative therapeutic strategies to address the root causes of CVD and promote healing in ways traditional treatments cannot. One of the most promising approaches that have emerged in recent years is stem cell therapy, particularly the use of umbilical mesenchymal stem cells, UMSC, derived from the Wharton's jelly of umbilical cords. Mesenchymal stem cells, MSCs, are a type of multipotent stem cell capable of differentiating into a variety of cell types, including bone, cartilage, and muscle cells. What makes UMSCs particularly attractive for cardiovascular therapy is their ability to differentiate into cardiac-like cells, their potent anti-inflammatory and immunomodulatory properties, and their capacity to promote tissue repair and regeneration. The umbilical cord, specifically the Wharton's jelly within it, provides a rich, ethically non-controversial source of these cells. Unlike embryonic stem cells, which involve ethical and legal complexities, UMSCs are harvested from umbilical cords that are usually discarded after birth, making them an abundant and accessible source of stem cells for therapeutic use. One of the significant challenges in managing cardiovascular diseases is the inflammatory process that underpins many of these conditions. Chronic inflammation plays a pivotal role in the development and progression of atherosclerosis, where the buildup of plaque within the arteries can restrict blood flow, leading to conditions such as coronary artery disease, heart attacks, and strokes. When a heart attack occurs, the sudden loss of blood supply to a part of the heart muscle results in an inflammatory cascade that leads to the death of cardiac cells, replacement with scar tissue, and ultimately the impairment of heart function. UMSCs offer a novel approach to tackling this inflammatory process. They possess a unique ability to home to sites of injury or inflammation and release anti-inflammatory cytokines that modulate the body's immune response. By reducing the levels of pro-inflammatory cytokines like TNF-A, Illinois, 1B, and IL-6, UMSCs can create a more favorable microenvironment that supports the healing and regeneration of damaged tissues. In addition to their anti-inflammatory properties, UMSCs contribute to cardiovascular health through their role in angiogenesis, the process of new blood vessel formation. Angiogenesis is particularly vital in conditions like ischemic heart disease, where the heart muscle suffers from a lack of adequate blood supply due to blocked coronary arteries. By secreting a range of growth factors such as vascular endothelial growth factor, VEGF, basic fibroblast growth factor, BFGF, and angiopoietins, UMSCs can stimulate the formation of new blood vessels. This angiogenic process helps to restore blood flow to ischemic areas of the heart, thereby improving oxygen and nutrient delivery to damaged tissues. Studies in both animal models and human clinical trials have shown that UMSC therapy can enhance myocardial perfusion and reduce the size of infarcts, the areas of dead tissue that result from the lack of blood supply. This improved blood flow not only aids in the recovery of heart tissue, but also enhances overall heart function, leading to better outcomes for patients with ischemic heart disease. Another crucial aspect of cardiovascular disease, especially in the aftermath of a heart attack, is the development of fibrosis or scar tissue in the heart muscle. Fibrosis occurs as the body's natural response to injury, where fibroblasts proliferate and deposit extracellular matrix components to form scar tissue. While this scar tissue can initially help to stabilize the damaged area, it also leads to stiffening of the heart muscle, reducing its ability to contract and pump blood efficiently. Over time, this contributes to the decline in heart function seen in heart failure. UMSCs play a vital role in mitigating fibrosis through their anti-fibrotic properties. They secrete matrix metalloproteinases, MMPs, enzymes that break down excess extracellular matrix components and inhibit the activation and proliferation of fibroblasts. This anti-fibrotic action helps to limit the extent of scar tissue formation, preserving the elasticity and contractility of the heart muscle. Furthermore, by reducing fibrosis, UMSC therapy may prevent the progression of heart failure and improve patients' quality of life. The direct regenerative potential of UMSCs also cannot be understated. While the adult heart has a limited capacity for self-repair, UMSCs provide a source of cells that can potentially replace lost or damaged cardiac cells. Research has shown that UMSCs can differentiate into cardiac-like cells and integrate into the heart muscle, contributing to the restoration of myocardial structure and function. In addition to differentiation, UMSCs release a variety of bioactive molecules, including exosomes and microRNAs, that have paracrine effects on the surrounding cells. These molecules promote the survival and function of existing cardiomyocytes, stimulate the proliferation of endothelial cells involved in blood vessel formation, and inhibit apoptosis or programmed cell death in the affected heart tissue. This comprehensive support for the heart's recovery is what makes UMSC therapy a promising strategy for patients with conditions such as myocardial infarction and heart failure. Beyond their local effects on the heart, UMSCs exhibit systemic benefits that can support overall cardiovascular health. For example, their immunomodulatory properties help to regulate the immune system, which is often dysregulated in conditions like myocarditis, inflammation of the heart muscle, and autoimmune diseases that can affect the heart. UMSCs can modulate the activity of various immune cells, including T cells, B cells, and macrophages, to reduce harmful autoimmune responses and promote a balanced immune state. This regulatory effect not only helps to control inflammation, but also reduces the risk of adverse immune reactions when UMSCs are used as a therapeutic intervention. Additionally, the antioxidative properties of UMSCs help to counteract oxidative stress, a condition characterized by an imbalance between free radicals and antioxidants in the body, which is a significant contributor to the pathogenesis of atherosclerosis and other cardiovascular diseases. Several clinical studies have reinforced the potential of UMSC therapy in improving cardiovascular health outcomes. For instance, in patients with chronic heart failure, the transplantation of UMSCs has been associated with notable improvements in cardiac function. Echocardiographic assessments in these patients have shown an increase in left ventricular ejection fraction, indicating a more effective pumping ability of the heart. Moreover, patients treated with UMSCs have reported an enhanced ability to perform physical activities, reduced shortness of breath, and an overall improvement in quality of life. In ischemic heart disease, where blood flow to the heart muscle is compromised, UMSC therapy has demonstrated a capacity to reduce infarct size and enhance myocardial perfusion. Some studies have also reported improvements in heart remodeling, where the heart returns closer to its normal shape and function after injury, suggesting a long-term benefit of UMSC therapy in cardiac care. The administration of UMSC therapy in cardiovascular treatment is relatively straightforward compared to more invasive procedures like heart surgery. UMSCs can be delivered through intravenous infusion, intracoronary injection, or direct injection into the myocardium, depending on the specific clinical scenario and the patient's condition. This minimally invasive approach is particularly beneficial for patients who may be at higher risk for complications from surgery or those who are not suitable candidates for traditional interventions, such as coronary artery bypass grafting, CABG, or percutaneous coronary interventions, PCI. Additionally, the use of UMSCs harvested from donor umbilical cords offers a practical advantage, as it circumvents the need for a complex cell extraction process from the patient's body and allows for the preparation of cell therapy products that are readily available when needed. An essential consideration in the application of UMSC therapy is its safety profile. One of the concerns with stem cell therapies is the potential for immune rejection or adverse immune responses. However, UMSCs have low immunogenicity, meaning they are less likely to provoke an immune response and possess immunosuppressive capabilities that reduce the risk of rejection. These properties allow UMSCs to be used in allogeneic settings, where cells from a donor are transplanted into a recipient without the need for stringent matching or immunosuppression, making UMSC therapy more accessible and scalable. To date, clinical trials have reported a favorable safety profile for UMSC therapy in cardiovascular patients, with few adverse events and a low risk of complications. Despite the promising results observed in clinical and preclinical studies, the field of UMSC therapy for cardiovascular health is still evolving. Researchers are actively investigating the optimal protocols for UMSC administration, including the best methods for cell delivery, the appropriate dosages, and the timing of treatment. Furthermore, understanding the mechanisms of action of UMSCs in various cardiovascular conditions will help to refine and enhance their therapeutic efficacy. Future research will also focus on the long-term effects of UMSC therapy, including whether the benefits observed in the short term are sustained over time and how repeated treatments may influence outcomes. In conclusion, umbilical mesenchymal stem cells, UMSCs, hold great promise as an innovative therapy for improving cardiovascular health. By harnessing their anti-inflammatory, angiogenic, anti-fibrotic, and regenerative properties, UMSC therapy targets the key pathological processes involved in cardiovascular diseases, offering a multidimensional approach to treatment. As an adjunctive therapy, UMSCs have the potential to complement existing cardiovascular treatments, reduce disease progression, and enhance patients' quality of life. While further research is needed to fully elucidate their potential and establish standardized treatment protocols, UMSCs represent a cutting-edge frontier in regenerative medicine that could revolutionize the management of cardiovascular diseases in the coming years. The journey toward integrating UMSC therapy into mainstream cardiovascular care is one of hope and excitement, promising new avenues for patients who seek not just symptom relief, but true heart healing and restoration.